If your neck pain disappears for a few days, then for absolutely no reason at all comes roaring back, you didn't lift anything heavy, you didn't sleep funny, you probably feel like your body is broken, but you're not. Hear me out. You're just missing one key piece that most people never learn. And by the end of this video, you're going to know exactly why it keeps returning and what you can do to actually stop that cycle. This video is for anyone who's tired of that same stiffness, that same ache, that same pain coming back time and time again, no matter how careful you are. If you're frustrated at this vicious cycle, I'm going to walk you through the hidden process behind recurring neck pain, why quick fixes never work, and the principles that create real lasting improvements. I want to make sure that you have a clear understanding about your neck that puts you back in the driver's seat and gives you back the confidence you should have in your neck and your spine. When people come into the practice, it's usually because they're in some degree of pain. They can't move normally, and then it's limiting them in some shape or form in their daily life. This might be, say, slowing them down at sport, or it might be simple things at home, just not being able to do the housework or playing with the kids. Now, although each person's unique and they have a particular diagnosis or a particular condition and a reason they got to this point, there's one single commonality that I see. And they all say that, this pain that you're in now isn't the day it started hurting. And let me repeat that. The pain that you're in now isn't the day it started hurting. That ache, that catch, that stiffness, those little one-offs that had been happening for years before, that was the warning light, and it was coming on early. It was a smoke alarm. It's that early warning that's ignored, but the alert itself is not the problem in and of itself. Let me explain that. Before that first little alarm even happens, by the time your nervous system gives you that danger warning signal, that stiffness, maybe it was that ache or that sharp catch, your neck has been often adapting and compensating, quietly reorganizing itself for months, sometimes even years. And for most people, they think that they just randomly kink their neck because they might have slept badly, or they sneezed, or they turned in an odd way. Now, the thing is, it's not bad luck. It's been a process that's been running in the background, often even without your awareness, for some time before you've been made aware of it with that form of symptom. So if it's not random, the next logical question becomes, well, what has your neck actually been adapting to? Most people will blame poor posture. And speaking frankly, who doesn't wish they had better posture in this tech age? We're all succumbing to the tech neck and those rounded shoulders. And with what we do day to day, it just keeps amplifying it. And the thing is that most people I see already have tried to, fix their own posture by, trying to sit up straight. They're doing all the exercises. They set reminders on their phone. They pull those shoulders back. Some people even go to the point they get braces to try and hold their body up. But very quickly, and often within minutes of doing this, they start to slide back into that same old position. Now that happens because posture is not simply a habit problem. It's an adaptation problem. Now your neck becomes very, very good, extremely efficient at holding the positions that you place it in the most often. Now, if those positions involve, say, forward head carriage, that sustained rotation if we're twisting all the time, subtle tilting for hours each day, the joints, the muscles, these nerves, they all adapt to that shape. So just think of that teenager that spends hours looking down at their phone, and then they take their phone away and they still look like, they're walking around almost like they have a phone in front of them, whether they have one or not. Over time, that adaptation changes how the neck sits and how it then wants to move. So we start to see certain directions. They might become stiff, where others become protective, and that range slowly reduces. And then one day, often after something very ordinary, they've done it thousands of times before, the system hits its limit and says, that's enough. And the pain signal turns on, and we become aware that there's now a problem there. This long-term adaptation also explains why so many things can give temporary relief, but they don't seem to last. You may stretch it, you may take a paracetamol, you might massage it, you'll get an adjustment, and you find things feel better. sometimes dramatically better. And you think, oh wow, that was easy, I'm fixed. But then a week or two later, that same familiar stiffness, that same ache, it starts returning. And once again, it's usually out of nowhere. And this is not a failure of your body, it's simply just physiology. Feeling better does not always mean that the underlying movement pattern or that loading pattern with that posture has actually changed at all. We've just taken enough pressure off to not feel it. So if the neck is still being asked to live in the same adapted position under the same daily loads, the system eventually returns to its familiar protective state. So what actually helps a neck stay healthy over the longer term? From what I see week after week, there's 3 things that stand out. The first one is that direction matters more than intensity. The right kind of movement, particularly if it's in the right direction, can begin to change how the neck organizes itself far more effectively than simply just doing more of something generic. The second is that consistent load input almost always beats occasional high load input. Small, thoughtful movements done regularly tend to create more durable change than just big, forceful efforts done as one-offs or very sporadically. And third, the neck needs specific input, not just more random effort. It needs movement and positioning that gently remind the system that there are other options besides just that protective pattern that it's been stuck in and learnt for so long. The big thing here is these are not quick fixes. These are principles that guide a longer term change. So to sum it up, neck pain isn't random, it's a long-term adaptation. It's adaptation that takes a long time to build up, and relief fades when we don't change the daily input. And the fastest way forward is matching direction and consistency to your specific pattern. Now, if that doesn't make sense, this is exactly what we cover in much more depth in our neck pain training. If what you've heard so far is resonating, I'd encourage you to watch it. Depending on where you're viewing this may be either live training we're going to do in a webinar, or we'll record that webinar so it's available as a replay. Now in that, we're going to go through the most common posture and movement patterns that I see. We'll go through a simple 10-minute neck routine you can actually use, and most importantly, how to start recognizing what your own neck actually needs so you can then help yourself. Big thing here is education first. There's no sales pressure, and you can watch it at your own pace and simply take out of it what's useful for you. Now for some people, that level of education and self-guided work is enough to create meaningful change. For others, the next question is more direct. They might want to know exactly what's happening in their neck, in their situation. And if that's where you are, a proper guided clinical assessment removes the guesswork. At Aligned here, we don't guess. We listen to your history, we test movement and function, we measure what we can measure, and then we reassess as we go. And that way, we're not guessing, we're understanding what you need. Now, if after that assessment, it turns out that we're not the right fit for you, we're not what you need, of course, we're going to tell you directly and point you towards someone who is the right person for your scenario. Now, if this video has helped you understand your neck better, feel free to comment below which principle surprised you the most, and hit subscribe for more of these no hype guides on neck health. And if you're ready for the full training, grab that webinar link in the description and I'll see you there.